Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Sapna Shah-Haque and Jackée Clement. Thanks for joining us today, Sapna and Jackée.
Sure, no problem. Happy to be here.
Thank you for the opportunity.
Sure, I'm happy to have you. And by way of a very brief introduction, because I'd like you to introduce yourselves, Sapna is a practicing internist, podcast host of The Worthy Physician, writer, speaker, and consultant. And Jackée is a family physician by training, and she's now a wellness coach and a keynote speaker. And today we'll be talking about how Sapna chose the Worthy Physician title for her podcast series, a deeper dive into what does that mean. And we could also unpack what is a good doctor, which is related. So we'll see where the conversation takes us. And as we get started, I always ask what you'd most like our audience to know about you. And you can include hobbies, really anything you'd like us to know. Sapna, would you like to go first?
Sure. Thank you. I appreciate the introduction. What would I like the audience to know about me? Besides being a physician, I really enjoy life, just different things, traveling, cooking, spending time with family, art. But yeah, some of my hobbies doing include the podcast and just being an advocate for physician well-being.
Well, that's terrific. We certainly share that. I believe all three of us do. And Jackée, what would you like us to know about you?
Yeah, great. So I'm Jackée Clement.
Oh,
It looks like Jackie, but it's Jackée, so you can say it with some pizzazz.
okay. Thank you.
Person, I'm so sorry, Kim. I wanted to meet you when you were in North Carolina, but I'm happy to be here and to meet you all now. Like you said, I'm a family medicine physician and wellness coach, and I'm really interested in the connection between physical well-being and mental well-being. And I feel like we're at this point in history where we're starting to appreciate that mind-body connection. I mean, even in Socrates' time, they talked about, psychiatric illness and how it could have a negative impact. But now we're starting to think about, just how positive well-being can actually have significant implications for like chronic disease and even aging. So I'm excited about that. And of course, I love life as well. And, I like to go on hikes and spend time with my family and all of that good stuff.
Well, that's terrific. That's something else the three of us have in common. So that's really awesome. And yeah, so Sabra, I had just thought that would be really a good way for us to start is I love the title of your podcast, The Worthy Physician, and there's just so much behind that. And so I thought we could start by you sharing how you came up with that title.
Absolutely. So it really all began in 2019. Um, my best friend from residency and medical school died by suicide in her office, and I really wondered why. Why would a beautiful person just want to take their life? But she left a note and said that she did not seek proper care of a psychiatrist or counseling because she was afraid of professional repercussion. And that really landed on me very, blew my mind because why can we not access the same level of care that we would prescribe for our patients? Why are we held to a different standard? And so I started reading about burnout and moral injury, and the rate just was astonishing. And to be honest with you, I didn't have the verbiage to describe that. And then compound that with as how many physicians we lose per day, or sorry, per year in the United States, 300 to 400 per year, and that's pre-pandemic. So I wanted to use a platform, that's the podcast, to normalize the discussion, figure out what the heck is going on, because this is really a public health crisis, not just within the patient population, but within our colleagues. And the worthy physician came about, the title, because we have to remember that we're worthy of love, we're worthy of sleep, we're worthy of taking care of ourselves. We're worthy of all that. But we forget our own humanity at times. And I really think that a lot of it's the medical culture that it's indoctrinated. Like we'll fall on that sword and put patients first always. But it takes our humanity out of the equation.
Yeah, absolutely. And I think you both know that I'm doing this work because one of my doctors took his own life, and I've recently become an ambassador with the Dr. Lorna Breen Heroes Foundation. And one of the things that we're working on is trying to remove the intrusive questions in every state, and that's very important. And I have a physical therapy license, and we're not asked those questions. On the back, it says, like, if you've been convicted of a felony in the last year, have you completed your continuing education? And that's pretty much it. And it should not be like that. Jackée, what would you like to respond to Sapna?
First, thank you for sharing that, Sapna, because that's a very, personal story. And I really just felt, some of your pain just hearing you express what you went through, what your friend went through. I think there's so much work to be done on this issue. And like you said, it's definitely ingrained in the medical culture. I mean, it starts with medical education, which is why I really like to work with medical students. I mean, I definitely fell into the statistic when I was at medical school where I developed severe anxiety, I developed depression, and there's this issue of how to manage it when you're in that medical sphere. Fortunately, I wasn't a practicing physician yet, and wellness was coming into play at the time that I was a medical student. And so I think we have a lot of work to do to like break down those barriers to care, proper care for medical students, residents, physicians who are suffering and need that help.
Mm-hmm. Yeah. Go ahead, Sapna. You could respond to Jackée.
No, I echo your response 100%. And I think when I was in medical school, the mantra was sleep when you can, exercise, and make sure to take care of yourself. But outside of that, I think that was the the end of the discussion. Kind of like nutrition, right? In medical school, we only get one or two lectures, but yet we're supposed to be experts in it, and truly we're not. And going back to what Jackée said at the beginning, the connection between the mental health and physical health, I think that we're just at the tip of the iceberg. And not only I'm just excited about the science that's coming out and more that we're finding of if we don't address, our feelings, our emotions, our stress, it manifests as chronic disease. Now, is that the only reason why it does? No. But is it a big component? I think so. I mean, stress literally kills.
Yeah, I just have to say that I'm so glad that so many physicians are talking about this now and talking out about it. And I feel like before the pandemic, that likely wasn't the case, even though I wasn't involved in these spheres. I just have been involved, through my own health challenges that all arose since the pandemic. So I feel like we are moving the needle, so to speak. There are, though, still physicians that do fear seeking help. So I think I always say every time a physician shares their story, another physician feels less alone. And every single time, we have people such as yourselves on there, right? Like sharing your stories. Jackée, I don't know if there's anything you'd like to share from your journey and how you got into coaching.
Sure, yeah. So I already alluded to it, but mental health really came to the forefront for me when I was in medical school, just because I consider myself to be, like a really spiritual person. My family, like my mom taught me to be more optimistic and positive and try to say, nice things whenever possible. And going into the medical field, I just had like this culture shock where we're expected actually to be more critical, more judgmental. And so for for the first time, I was really, really anxious. And I think that's what led into the depression. And I think I also can't ignore that I'm not your standard physician, right? So I don't look like your standard physician. I came from a divorced family, inner city of Baltimore. So I think that contributed as well. So I really think we need to address this, especially when it comes to some of our like minority students or physicians. Um, I could actually talk about this like all day long, but long story short is I really had to do a lot of the work myself to figure out how to be well within the medical system. And the answer for me was to go a non-traditional route. So I did family medicine because I knew it would allow me the freedom to be myself more than the other specialties. And then I chose to do locums medicine so that I didn't have to work all year round. I worked when I wanted to work so that I could kind of protect my mental health. And then I also decided about a year or so out of residency to become a mental health and wellness coach so that I could then just share the knowledge and the experience that I had with other students, residents, physicians, and professionals. So, yeah.
Mm-hmm. Yeah, that's so important. Sapna, what would you like to say?
That's awesome that you figured it out early because so many are behind the eight ball when trying to figure that out. So good for you.
Thank you.
I love hearing that.
Thank you. I think that was mainly just honestly, my mom, because she was into like Eckhart Tolle and all of these kind of forward-thinking authors, gurus, even before it was popular. And so growing up, I just thought like, okay, she's kind of like a hippie-ish person. And then I realized how valuable it was when I started to have my own struggles. And yeah, so now I try to apply that even in medicine to try to help people change the way they're thinking about their illness and even just their life stressors.
Mm-hmm. Yeah, that's terrific. And so I know we've been talking about the worthy physician, and as Sapna said, you know, every person is worthy just because you're you, right? Nothing, you don't need to do anything to prove that you're worthy. You just are. And related to that is when I interviewed Dr. Manjeet Obrai and Dr. Yashika Dooley, it ended up coming up. We just spoke for a minute or so about a good doctor. And, you know, what is a good doctor? What does it mean to be a good doctor? How is that perceived by both the physician and the patient? And I was wondering, Sapna, if you'd like to speak to that.
What makes a good doctor? I think for me, it's because I'm a patient too, right? I'm a patient too. Um, it's to build a relationship of trust, and it's to understand that this is a collaborative way to approach. My patients are the experts in their bodies, and I'm trying to put it together from a medical perspective. Now, I can prescribe things left and right, but it's the patient's body, and I have to honor that at the end of the day, it's their decision. And it's my job to provide them education so that way they can make an informed decision. Now, I don't agree with a paternalistic style. It's more of a mutual agreement. And it's a journey, just walking it together.
Yeah, I love that. And now I'm on some medications because of the things that have happened to me. And I love that my nephrologist, well, you know, when he had to prescribe one or two medications, but then that had effects on lab work, and then you had to add a third one, right? And then the fourth one. And I wanted to get rid of these medications because I was like, I didn't consent to any, you know, like it was because of something that happened that I was on these. And I thought, well, if I could minimize the first one, then I wouldn't be having the effects on the lab work, you know, for the second two. And that he was willing to help me try. It didn't work, but that he knew that that was what was the most important to me, because some people don't really care. Like my dad, he passed away 7 years ago, and he had diabetes. He died of pancreatic cancer, but he was on dialysis. But he would order marshmallow peeps on the internet, like literally. And so he was like, you know, give me the dialysis, do whatever, but I'm going to eat what I'm going to eat. Where I was the opposite, and I would do anything that tell me, like, my top priority was to try to reduce or minimize my medications. So just, you know, if that doctor was treating me and my dad, right, it would look very different, and just, you know, respecting that. So yeah, thank you for pointing that out. Jackée, what does that bring to mind for you?
Yeah. First off, I love that your dad was ordering Peeps. That was my favorite snack when I was brings back memories. I can't eat them now, but yeah, good times. I think I'm really happy that your nephrologist actually listened to you about your concern. One of the things that I actually worry about with, I guess, just the reputation of doctors these days is that, uh, patients feel unheard, and I'm not sure we're doing everything that we can to really address that issue. We have so many constraints that's out of our control, and obviously I know that. But a lot of times, even when patients come in and communicate to us, like you did, the things that are important to them, I will see colleagues and even sometimes myself not want to listen because of some reason. You're running behind, or you know it's not going to work, or just what have you. But I think it's so important to protect the doctor-patient relationship because it's such a sacred relationship. So just listening and being non-judgmental and trying to, do shared decision making about everything is so important. So, I mean, because it's not our body, right? So we shouldn't have to tell a patient like, yeah, you have to take this medication. If they're uncomfortable, we should really try to talk to them about it and see, what's the best way forward that will make them feel like they're in control of their health.
Yeah, 100%. And I'll share another example as I had to have another surgery this spring,
Oh,
and the physician who performed the surgery thinks I should have a bigger surgery, again, to prevent cancer. You know, I had some changes and she thinks it might turn to cancer. But I don't want this other surgery. I said, I don't have time for that and I don't want to do it, right?
yeah.
But my other doctor, and again, so I have a couple other doctors who take a more conservative approach, and they actually talk to me about, well, what's more important to you? You know, what's the most important? And we've had conversations about it. And you know, I just love that. That, you know, we're thinking about it and talking together, so they're not telling me what to do or what I should do. We're having conversations, and based on what my priorities are, you know, we're making a plan, and we all decided I'll have a follow-up scan in December, and, you know, and take it, and then I'll see the doctor perform my surgery, and we'll take it from there. So I do really appreciate that, truly being a, you know, a partner, and it is a collaboration. Sapna, what does that bring to mind for you?
I agree with what you and Jackée have said. You know, I don't want to come off like I give advice. I give medical advice, right? And the patient can choose to not do it. That's their right. But I think that there's a lot of guidance from the point of a physician to a patient. And you know what? If, let's say, for example, hyperlipidemia, mine's familial and I don't want to go on a statin. So I have tried cutting out red meat. I've tried going vegan and it didn't work. So guess what? I'm on a statin. But I appreciate the ability to try those things, and I try to apply that in my own practice as well. Because, you know, there's a lot of fear of medications and long-term side effects. And even though I'm a physician, I mean, I don't want to be tied to something for the rest of my life potentially that I might be able to do by lifestyle change. So if a patient wants to try that, yeah, I totally think that that's valid. And, you know, let's assess and reassess.
And I also think that sometimes there's better compliance when the patient really understands and, you know, is able to try those other things. And for example, in an hour, so I'm going to be having a conversation with my medical oncologist, because now I'm on a medication and it's causing some side effects that I don't love. And I'm going to talk to him. I'm going to say, could I just take this like every other day or 3 times a week? But you know what? If he says no, I know that it's because he has my best interest in heart, and that we've had other conversations So then I will respect him and trust him. Jackée, what would you like to say?
Yeah, I mean, you're right. It does build trust. And like Savna said, we also can be patients ourselves. So I just want all the physicians who watch this to think about what they would want if they were in the patient's shoes, you know?
Mm-hmm. Yeah, no, that's true, 100%. So Sapna, is there any tips you have for your colleagues from seasoned physicians to medical students or even those considering med school?
Don't drink the Kool-Aid. What I mean by that is uh, keep in mind that the medical system, the culture will say, but you're a doctor. You're supposed to put patients first and always.
Mhm.
But that's not the truth. Now, in some specialties, it might be more difficult, but I would say have those hard boundaries of what you're not willing to give up and stick to those because that will help you choose, um, make different decisions throughout life. And as you go through life, those boundaries or those priorities may change, and that's okay. Like, this is not set in stone. So I would say take an example from Jackée and really dig into what makes you tick and what you appreciate and draw those boundaries. I love the fact that you've done that so early on. So that's awesome. Use that as an example.
Thank you. Oh, yeah, and I agree with you. So I don't know if I can add more to what you've said. I may digress a little bit and just say to future doctors and current doctors, you know, keep an open mind. There's so much that we're learning about medicine. It's rapidly changing, like exponentially. And so I just think that as patients are Googling and finding information out there on the web, that we need to be non-judgmental and really consider if there's some truth to it, you know? I know that's kind of off topic, but I get really agitated when I see physicians who put down patients for trying to have some autonomy over their health. So yeah.
Yeah, no, thank you for sharing that. And when Sapna was speaking to as far as the patient comes first, and I think that's unfortunate that that's drilled in so much. Now, of course, if you're in, like critical care in the ICU and you would rather be eating ice cream, right? You got to be treating your patient. But when you leave the patient's bedside, it's true. It can't be the patient comes first, like see 10 more patients, do my notes and not get enough sleep, like all of that, right? You do have to take care of yourself to be able to make medicine sustainable and to take care of patients, or you're going to end up with chronic illness. You're going to get burnt out. So that's like one of the biggest lies that is just drilled into your head for all those years of training is there's a balance there. So thank you for pointing that out. Is there anything you each would like to speak to as far as what has helped you overcome challenges, Sapna?
Therapy and a life coach. In 2019, after reading the letter from Dr. Bicker, and then the pandemic hitting, I really, when the first year anniversary came around to her death, I did not know how to process those feelings. And so I sought help. I'm not ashamed to say that. I'm actually really proud that I did because that kind of says, hey, I know myself and I'm willing to pay attention to what my body is trying to tell me when something seems off and I'm going to address it. So I see that as being proactive. Um, and not to give myself a pat on the back, but now 3, 4, 5 years later, um, what I learned through those 3 years of therapy and life coaching have made me a better person and better physician. Has made me a better mom, a better friend. So, and then through that, I also was able to be okay with drawing my boundaries and holding to them, and also understanding that they change with time. And each season in life is going to bring a new lens, and I need to honor that.
Yeah, well, I can identify with that, and I think Jackée can as well. And I happen to find my physician coach, Dr. Michael Hirsch, who I know that you know. And a couple months after my doctor died, and at first I just thought I have to tell one more person, and then I'll feel better. And when I came across him, and we had a conversation. But then we kept communicating, and then he became my coach. So it wasn't like a one and done, and now it's coming on the 2 year anniversary. And when you experience at first I thought, okay, once I process it, I'm done. But trauma isn't like that, right? And it resurfaces. But just being able to have those kinds of conversations and realize it and normalizing that. And so I really appreciate everything you said. Jackée, how about you?
Yeah, so I think I'm going to go out on a limb and really talk about something I'm usually too shy to discuss in public, the way that I was able to overcome some of the mental health issues that I was having. See, I'm getting nervous just thinking, like I can't even I can't even get the words out because
We're
I'm afraid,
friends.
like the judgment that I may receive because it's a little out there. I think the public is starting to come around to it, but I honestly had to start telling myself a different story. I had to reprogram my mind, as it were. And I think in terms of mental health, a lot of what's doing the damage is not physically real. It's all in our head, but I don't want to make it sound like it's trivial. It's really important that people understand. I think it's 100% um, like negatively impacting us, right? Our thoughts have power. And that's the simple statement that really helped me get through having anxiety, having depression, was just, I need to take a step back, not be so attached to how I'm thinking, um, such that I'm producing emotions that go along with that. Is that making sense? Because, yeah. And so I think that really pulled me out of the slump. And even today, when I have setbacks, then I rely on that one skill. Like, what am I thinking? How do I feel when I think that? Is there a way to think something that's just a little bit better? And then I just keep moving forward.
Well, and that sometimes you can't do it for yourself, and we all need help sometimes, and that it's a strength, not a weakness, to seek help. And like Michael says, you can't read the label from inside the jar. So even when you are a coach, right, you need someone else to reflect those things back.
Of course, yes. And I had my own coach. She was amazing. Another family medicine physician. So definitely, if you need help, just look in your circle, look outside of your circle, find the help you need. Yeah.
And there's so many resources these days, and I've shared free and confidential resources for physicians. I've shared posts where physicians who are coaches, can share their contact information, and I'll be doing that again probably next week or as we're coming up on, because of course we're getting close to September, which is I believe National Suicide Awareness Month, and then September 17th is National Physician Suicide Awareness Day. So it's important to talk about these things. Nobody wants to talk about it, but we have to if we're gonna change things and make a difference.
Right.
Sapna, was there anything you'd like to add? Yeah, Sapna, was there anything you'd like to add?
Oh, just reminding the listeners that discussing suicide does not increase the potential for it. You actually might save a life by discussing it.
And I think that's an important point, because I think sometimes if people have a colleague that they're a little worried about, I've heard that some people say, like, if you come out and ask, have you considered hurting yourself or something, that you might give them that idea. But I think, to speak to your point, that it's the opposite. So, Jackée, was there anything you'd like to add?
I mean, I agree with that statement. I think being just, upfront with who you're concerned about and saying, hey, I see that you seem a bit down, and I just want to let you know that I'm here for you if you want to discuss these things and, go from there. I think bringing up suicidal ideation is definitely not going to make someone commit suicide. So I agree with everything you're saying.
Hmm. And what also I think is when if you are concerned about someone or if they seem a little down, and if you just say, "Hey, how are you?" And we all just say, "I'm fine," right? But
Right.
sometimes if somebody asks you again, because this happened with me, like even people from my church when they'd see me in like the ShopRite parking lot, right? And once if they just say, "Oh, how are you?" and I just say, "Oh, fine," and then a couple different times there were different people, and they said, "Well, no, how are you really?" Because they know I was going through cancer 3 times and everything was happening, and they were thinking, "Well, how could you be totally fine?" So then I would share a little bit more. So that's in your own, the way, whatever way you're comfortable, is asking a second time or in a different way so that they know that you do genuinely care. Sapna, does that bring anything that you'd like to add?
Rings a bell. We're all so conditioned to say, "Oh, I'm fine," and that's really a social norm, isn't it? To say I'm fine even though when you're not. And I have to come back and say, like, that those people said to you, "No, how are you really?" Like, from one person to another, how are you really doing? Because you don't look fine. Like, you're not your perky self, or you're not joking as much as you normally do. So what's going on?
Mm-hmm.
Just
Yeah.
acknowledging that that behavior is not the person you're used to interacting. It's like something's off. What's going on?
Go ahead, Jackée.
Yeah, sorry. I wanted to make sure I didn't interrupt, but I agree with what both of you are saying. I'm so glad you brought it up because I also have experienced that where, if someone asks me how I am, I just say I'm fine. So I hope we can create a culture where it's okay to say, I'm not doing so well and this is why, and not have it be like um, you know, abnormal. Like maybe that would be our cultural norm, is that we get to express our emotions openly and honestly. Yeah.
So let's say if every single one of us does our part on both ends, is like Michael has also said, it's okay to share, put little pieces of yourself out there and share little pieces of yourself. So when you think everyone else is walking around like acting that they're really fine, you might not, well, you'll think, well, everybody else is fine, I should be fine too, and you might be embarrassed to share that you're not fine, but realize that maybe just about nobody's fine, right? That everybody has something going on. And
Yeah.
if you share, sometimes it might start with you sharing a little bit about yourself that might help them feel comfortable sharing.
Yeah, and actually, I started implementing that in my practice in, I think, residency. And honestly, you ask the patient how they're doing, they say they're fine. And if you just pause the interview and really look at them, in the eyes and ask them again, you'd be surprised the things that they're going through. I mean, I feel bad. I mean, so many people cry, I feel like, but they appreciated at the end that they were able to get that out in the office. So, yeah.
Mhm. Yeah, no, for sure. So Sapna, if you'd like to tell us what you're doing in these spaces and how our listeners can get in touch with you.
Sure. So my podcast is the Worthy Physician Podcast, reigniting your humanity and passion for medicine. Uh, the backbone of it has really been physician wellness, burnout, moral injury. And so the podcast continues. There'll be some restructuring in 2025, so that'll be exciting to announce later on during the year. But you can read the blogs, sign up for the newsletter, and come check out the episodes at theworthyphysician.com.
All right. Well, thank you very much. And how about you, Jackée?
Yeah, sure. So my business is Good Journey Mental Health and Wellness. And currently I'm focusing on helping medical students who are suffering with, the academic stressors and pressures that they're under. But I'm also going to be expanding to residents and physicians. I currently have a blog that's focused mainly on medical student issues, but I also have some general content out there for people. If you go to goodjourneywellness.com, you can read the blog.
Okay. Well, thank you very much. And have I already connected you with Dr. Amruti Borat and Dr. Frances May Harden?
I don't think so.
Oh, okay. Well, we'll consider this your introduction, but I'll have to send you links because Amruti also focuses on medical students, and Dr. Frances May Harden has a website and she focuses on residents.
Oh,
And they're both really awesome, like both of you are. They're amazing, and I'll have to connect you.
oh,
Uh,
I'd love that. Yeah.
yeah, awesome. Well, thank you both again very much for being my guests. This was really an important conversation. And even though we live in different areas of the country, you know, I'm not a doctor, right? It just shows when we all share our stories, the underpin, we're humans, right? And these are human issues, human struggles, and there's more the same than's different.
100%. Thank you.
Okay.
Thank you for having us.
You're very welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.